with these tests, you're going to palpate the PSIS, okay? And let's see, step back just a little bit. Sorry, people. Sorry. With this, we're going to palpate the PSIS, and we're going to have her bend forward. Give me a second. I'm going to find them first. Okay. And I'm going to palpate the PSIS as she bends forward. And what should happen, what should they do? Move up or move down? If her hamstrings aren't like super, super tight, they should move up. Yeah. So go ahead and bend forward now. And I'm going to follow them up. Yeah. And come back up. Okay. And on average, kind of a normal amount is about 5 millimeters. Okay. 4 to 5. In terms of what you would feel, but it should be symmetrical. Okay. So you can palpate the PSIS, and they should move up symmetrically. All right. You can do that in standing, and you can also do that in sitting. Now, if she had a displacement, so if she was stuck in anterior or posterior rotation on one side, okay, what would happen is when she bends over, let's say she's stuck in, and it doesn't matter, this is what's kind of unusual about this, whether it's a posterior rotation or anterior rotation, if she is stuck, then what will happen is that side will move up first and fast. It'll be an automatic boom, okay? So go ahead and bend forward, yeah. So it would do this. The other one would go up, but it would go up a lot, and it would go first and fast. So I'll do it again. Go ahead and bend over. So it would do that, okay? If she was stuck, and it doesn't matter whether it's posterior or anterior rotation. So this is a screening test, an active movement test for a displacement, okay? The reason they think it comes up with either one is because the whole joint is stuck, so it's going to bring both surfaces, and it's going to pull it up, okay? It's not going to stay behind. Let's say she had hypermobility. Okay. In terms of, with this test, sometimes that side will lag behind a little bit, okay, with hypermobility. So go ahead and bend forward for me, and you might see this, okay, where it was a slow, nice movement, and hers are easy to feel, and you should be able to feel this pretty well. It may lag behind a little bit because there's a little bit of increased length of the ligaments. Because you're bending the lumbar spine, you're bending the sacrum, it should bring it forward as she bends forward, and you're just feeling for symmetry, okay? So this is a good test for a displacement. So let's just stick with that one. I want you to feel the movement superiorly. Might be good if you switch to somebody else, different PSISs and movement, okay? Thanks.